Hi and welcome. I'm trying to learn medicine. Today, arterial thrombosis, and after we've done that, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about medicine and internal anatomy and the blood system. And this is no medical advice, we just learn. Arterial thrombosis, that is clotting of blood, clotting of blood in a short segment of an artery which completely obstructs the normal flow of the blood. Heart, brain and leg arteries are the most commonly affected, but any artery can be involved. See coronary thrombosis. Now I have a little question to it. Or is it just that I have a leg, leg, heart and brain, that where it becomes obvious that an artery is obstructed? Because wouldn't it be strange if these few arteries would be the ones mostly affected? I would just want to say there's a correlance between these three regions named and the three regions which are the most severe if it happens, and the easiest one to see that it happens. So arterial thrombosis, that is clotting of blood in a segment of an artery, and oftentimes or commonly it is heart, brain and leg arteries. So brachial artery, femoral artery, and I have to get the other one. The coronary thrombosis can be also be looked at. So for arterial thrombosis of a leg, see intermittent claudication. That is the pain in the calves, and that comes after exercises. Symptoms of arterial thrombosis: sudden onset of pain, usually in a limb when at rest. So arterial thrombosis has usually starting of pain in a limb when resting. The affected limb is colder and paler than the other. Causes: usual apheroma. This is a degenerative condition which begins in early adult life and causes increasing symptoms with age. We didn't have apheroma before now, so I don't know what it is. Okay, the symptoms are pain in a limb when resting, and the causes is oftentimes or usually apheroma, which is a degenerative condition, so it gets more and more basically. The things are getting worse basically, and it starts in early adult life. Treatment in the home? None. Consult the doctor at once. So we're saying if there's pain in a limb, then resting, and if the limb is colder and paler, then consult the doctor. What the doctor might do: arrange urgent admission to a surgical unit which can investigate the possibility of arterial grafting. Arterial grafting. I don't know what it is. Arterial grafting. Prevention: do not smoke, do not overeat, and avoid being overweight. We have to pay a little attention if they always, when they talking about prevention, if they only name the things which make it worse, or if they also sometimes name the things which would make it better. Because if it is about overweight and eating and smoking, very often these things can be beneficiary to do exercise or something like that. So oftentimes, if it can be prevented or made less severe through not smoking, not overeating, not being overweight, then there are oftentimes also things which can improve it. Outlook. Arterial grafting. Now, is it now arterial thrombosis or arterial grafting? Arterial grafting has considerably improved the outlook for localized arterial thrombosis. Okay, arterial grafting, that seems to be the treatment done in the hospital. And this arterial grafting has considerably improved the outlook for a localized arterial thrombosis. But if the whole artery is narrowed and diseased, surgery may be impossible or of limited value. The life of the limb will be in danger and amputation may then be necessary. Okay, I want to add again that the book here is 40 years old and I haven't heard of that recently. Whatever, it's serious and it's not good. Okay, what did I say? Atrial grafting has considerably improved the outlook for localized arterial thrombosis. But if the whole artery is narrowed and diseased, surgery may be impossible or of limited value. The life of a limb will be in danger and amputation may then be necessary. Okay, it is pain in the limb when it's resting, and that limb is then also oftentimes colder and paler. Consult a doctor, and they are looking if maybe artificial arterial grafting is possible or something like that. And maybe that can help, but if it's completely closed, then maybe even amputation is necessary. But again, I don't know. In the last 40 years, many things have improved in treatment. And it is clotting of blood in the segment of an artery. And when it gets obstructed, the blood cannot flow anymore. And to prevent it, they advise not to smoke and not to eat too much and not to be overweight. That was the medical part. If you wish for medicine, you can go directly to the next video. We will do now the short impingement training. If you participate in the short impingement training, it's at your own risk. Go to stable stand, and we're doing forward shoulder circuits with our back, up, and front, and down. And backwards. And now, long arms, strong fists, and go as far back as you can with the shoulders. Higher, and front, and down, and back, up, front, and down, and now backwards. Up, back, down, front, up, and down. Now we'll lift up. Go to stable stance, long arms, bring the shoulders back, and together, and now turn the arms to the inside. Now the arms to the outside, shoulders still down. And now the arms again to the inside, shoulders down and together. And the arms to the outside, shoulders down, together. And release. It's chocolate. That is with leaving blood away. Okay, next exercise, we're having the arms at the side. Bring them a bit to the front. And now, the arms in front. And the shoulders down and together. Now the arms back, shoulders up and the front. And the arms in front, shoulders down and together. And again the arms back, shoulders up. And release. Now lift the arms up. And shoulders up. And release it all down. Again the arms up. Shoulders up. And all down. Again the arms up. Shoulders up, and go down. Now we press the core, arms together, bring them down to the outside, just to relax a bit, and also to observe what the scapes are doing. If they are moving properly and forming a perfect circuit for the humerus. And last arm together. And now, the sunlight. Long arm out, and let the sock or tennis ball or whatever fall down and try to catch it again. And now on the other side. And just stretching. One arm in front, shoulder is back, it's down. Pull the arm in, have flat fingers, try to relax the arm, go it back with the shoulder, turn the palm to the sky. Change. The other arm in front, shoulder is back, down, pull the arm in, have flat fingers, try to relax the arm, go it back with the shoulder, turn the palm up to the sky. It was a short attention training. I thank you very much and until next time.